Pennie is helping Pennsylvanians connect to health coverage, and this morning we want to make sure that you and your family are covered. Devon Trolley is the executive director of Pennie, or the Pennsylvania Health Insurance Marketplace, and joins us this morning. Devon, thank you so much for joining us in person today. Great to see you. First, tell us, what is Pennie and who can enroll?
Sure. Well, Pennie is the Pennsylvania's official health insurance marketplace. It's really for anyone who doesn't get coverage from another source. So if you don't get employer coverage or you don't qualify for Medicare or Medicaid, it's the place to start. We have about 500,000 Pennsylvanians enrolled, and they cross a wide section of people. So we have part-time workers, gig workers, farmers, small business owners, really a lot of people who just don't have another source of coverage.
Very, very important information to know about. And what are the benefits of enrolling in health coverage?
Yeah, well, health coverage is really about protecting your health and your financial well-being. And there are two really important benefits to enrolling through Pennie. The first is about quality. You can have a wide selection of health plan options from a lot of major health insurance companies, and they all have one thing in common. They have the maximum consumer protections. This means care for pre-existing conditions, covering a wide range of essential health benefits, and protection against financial protection in the case of a medical emergency. The second key benefit is that a lot of times this comprehensive coverage is can be too expensive for a lot of people. And Pennie does help with costs. We're the only place to get an on-the-spot federal premium tax credit that instantly lowers the cost of coverage. So instead of paying $500 or $600 a month, many Pennie enrollees pay $10 or $200 or $100. It really depends on your income. So you pay for coverage based on what you make.
That is so important because that is such an issue with getting insurance. So that's so nice that that's an option really helpful for so many people. Now, what are the deadlines? This is also very crucial information that you need to know about enrolling for a health plan.
Yeah, well, there's one coming up on Monday, December 15th. It is open enrollment, which means it's the only time of year to enroll in health coverage for 2026.
Okay.
So if you miss this window, you will be locked out of coverage until about this time next year.
Okay.
And December 15th is a really important time frame to enroll for January 1st coverage. So if you enroll by Monday, you'll make sure that you get your insurance cards and all your questions answered before the holidays in time for New Year's Day.
Okay, very important. Monday, December 15th. Thank you for sharing that. And tell us what's new this year.
Yeah, so there are a lot of changes in Pennie due to some federal policy changes. Unfortunately, one of those changes is that costs are going up quite a bit because some of the premium tax credits are not being extended into 2026. At least they have not been at this point. So what that means is that if you're already a Pennie enrollee, this is a really important time to come in, update your application, and look at all of your options for next year to make sure that the monthly cost still works for the budget of you and your family. If you are uninsured, this is also a really important time. Don't let the discussion around higher costs dissuade you because it really varies person to person. And if you go to Pennie.com, it only takes a few minutes to get a preview of what your tax credits might be and what your health plan costs would be for 2026.
That is such important information, and I appreciate how you broke that down so easily in layman's terms for us to understand. Devon, how can you enroll or get help finding a plan?
Yeah, so you can do everything right on Pennie.com. That's PENNIE.com. And you can apply for the tax credits there, look at all of your different plan options and whether they have your doctors and prescription drugs in network. And we also have a lot of other help. So if you want to do it all online, you can completely do that. If you need some questions answered or need extra help with the process, a wide range of options. There's a call center, in-person help throughout the Southeast Pennsylvania area. And also different online options like chats and things like that to get your questions answered.
Excellent. Well, thank you so much for sharing all of that with me and with our viewers. Devon Trolley from Pennie, thank you so much for joining us today and sharing that with us.
Thank you.
Great to see you. Now, December 15th is the deadline for coverage that starts on New Year's Day, as Devon mentioned. And for more information, go to Pennie.com or you can call 844-844-8040.